Good day everyone, my name is Wenyi. I will be presenting on my assignment on how might we improve mental health and well-being. The purpose of the project is to look at mental health and well-being in Singapore and look at how we can tackle these concerns. Part 1. Observation, Depth, and Field Research. The next couple of slides shows data on mental health concerns in Singapore. Data show that 1 in 2 Singaporeans stated that stress are affecting their daily life. Data from Ministry of Health shows that 17% of Singaporeans faced mental health issues last year in 2023. More than half of the people interviewed said that they feel stressed to the point it had an impact on how they live their life. This brings us to our initial problem statement, which is the rising prevalence of mental health issues in Singapore. I conducted a field survey with colleagues, friends from social work, and even staff working in childcare centres. The result show a gap in mental health awareness, knowledge, and access to resources. Which brings us to the refined problem statement, which is significant gap in mental health awareness and lack of access to publicly available information. Next, I drafted a scope map to look into the scope. The scope are ownership, people, success, change, current state, and immediate success. Ownership refers to who is responsible for the project. People refers to who will be working on the specific aspect of the scope. Success refers to KPIs. Change refers to what will be changed. Current state refers to existing process, and immediate success refers to how success will be measured. The scope map was refined to define the elements. Next, in this slide, the scope map was then further refined and finalized. Ownership would be the project manager. People will be like the app develops. Success is if the app has high number of downloads, high number of active users, and so on. Change is the addition of AI into the app and make the app not for profit. Current state is that currently very little apps provide information on mental health, or it comes with advertisements or need to pay. Evaluate success would be to be looked at the number of downloads, number of positive reviews, number of people using after a month. We can also collect user feedback as well. With that, I have finalized the problem statement, which is lack of a tool that can provide knowledge to public with regards to the topic on mental health. This brings us to part 2 of the assignment and presentation. Design thinking process. Define the problem. I use the 5 whys analysis to understand and define the problem. This also brings us to understand that there is a lack of educative tools like apps to tackle the problem. Lack of awareness. Why? Because people not willing to find out more. Why? Because of misconception about treatment. Why? Because people are worried about stigma. Why? Likely due to culture and society factors. Why? People unsure when and where to look for help. Why? Because lack of a easy to get educative tool like apps. In addition, I also use the 6 stage of the design thinking process in order to get a clearly picture of the problems and its ideation process. The 6 stages are advertise, define, ideate, prototype, test, and implement. Here, as you can see, I went through very detailed process using the 6 stage of DTP. The plan was not just to create a prototype, but to also test and implement it. For the ideation process, I did a survey with focus group, which is my classmate. This was to ensure that the prototype will have a higher take-up and usage retention rate. Take a look at the findings. Survey results suggest that a mental health app should prioritize privacy, accessibility, engagement, and crisis support. In addition to file-wise analysis, sample analysis was also used. Purpose is to enhance existing solution, eliminate unwanted things while at the same time suit the needs of local population in Singapore. The slides after this looks into the details of the sample analysis. For substitute, I substituted traditional flyers, which is messy and has limited reach to the public, with a mobile app instead. For combine, there are so many information everywhere, so I decided to combine the key information into the app where it is concise. I also decided to adapt features like adding AI chatbox, add games, and mindfulness exercise into the app. Here, I modify some interface like allowing users to enlarge the font size, modify the color scheme to make it calming, and also condense complex information into easy to digest the points. Here, I decided to repurpose some of the function like creating an online forum, tailor-made wellness programs for workplace or schools, and personalized plans for everyone. Next, I decided to eliminate common app filters like removing ads, remove compulsory login, and eliminated the need to pay. After multiple consideration, the addition of some of the elements were reversed and removed due to PTBA. The app will not be collecting or storing any data. This brings me to part 3 of my presentation, which is define the solution and features. I first created a flow chart to outline the major stage involved in prototype development. I then drafted a wireframe to sketch out the flow. As you can see, it is very complex. Upon refinement, the second draft of the wireframe was sketched out. As you can see now, the contents have much more details. In addition to wireframing, I also use Lego sets to help with the prototyping, like working the scenario and user interface. It was a very fun process. The Lego set was used as a medium fidelity tool for prototyping. The aim is to use the Lego to map out the user journey and test user interaction to optimize user experience. Next, I used JavaScript to code the creation of the app. Process was very tough and there were a lot of errors at the start. There is a saying, tough times don't last but tough people do. After multiple attempts and improvements to the coding, the apps was finally created. Hooray! Next was to test out the prototype. A volunteer volunteered to test the prototype and gave his honest feedback. As you can see, he had a lot to say and comment. Still, I took in his recommendation. With the initial feedbacks, I made some changes to the app and further testing were conducted. This time, many volunteers volunteered to test the new prototype. Volunteers were very satisfied with prototype and found it very user-friendly. Many good and positive comments. With that, I uploaded the app onto Google Play Store and Apple Play Store on 5th December. Hooray, major achievement. There is a saying, aim for the moon. If you miss, you may hit a star. I did not just stop here. Next was value proposition. I proposed to the head of clinical psychiatry in National University Hospital NUH in hope that NUH would take out the prototype and incorporate it as part of their clinical care. It was a very challenging road. I was very scared. Nobody did this before, but fear makes a person grow. I presented the problems they are facing, proposed the solution to them, which is the app, and highlighted the benefits to them. Take a look at my proposal. Luck only presents itself to people who try. Shortly after, I received a reply from the head of psychiatry department. They are willing to use the app in their clinical care program. Hooray! Second major achievement. I'm so happy. So finally, for reflection, this project was a very fun and wonderful experience. I would like to sincerely thank my module mentor, Dr. Lim, for his guidance. I'm very grateful for this opportunity. Thank you, Dr. Lim.